Come in.
Hi, good morning. How are you?
Good.
Go ahead and do some hand hygiene. Providing privacy for my patient. Hi, my name is Nyree, and I'll be your nurse for the day, okay?
Okay.
Can you tell me your full name and date of birth?
John Doe 1101.
And do you have any allergies?
No.
No allergies. Okay. Well, Mr. Doe, I've reviewed your chart and I see that there's orders in for NG tube. And so I'm here today to place that NG tube for you. In doing that, I'm going to insert the NG tube through your nose, down your throat, and into your stomach. And the benefits of this is I'm going to connect this to suction, and the suction is going to help alleviate any kind of discomfort in your stomach. I'm also going to provide nutrition when doing this, and also giving you your medication. Okay?
Okay.
All right. So I'm going to lift the head up to hip level. Lift your head up. So I want to ask you a few questions. Have you had any history of aspiration?
No.
Any history of nosebleeds?
Nope.
Nasal polyps?
Nope.
Any oral, facial, or sinus surgeries?
Nope. None of it.
None of it. Okay, very good. All right. So what I'm going to do first, I'm going to go ahead and gather my supplies, set my tape up. Let me get some gloves. I'm gonna get my stuff, and first I'm going to measure the tube to see how far I need to put the tube into your stomach here. So I'm going to measure from nose to ear, xiphoid process, and that's about 61. I'm going to go ahead and do my placement. Now I'm going to go ahead at this point and look into the patient's nose with my pen light. And what I'm checking for is to see if there's any obstruction if there's any nasal polyps, check irritation of mucosa, and also if there's a septum defect in the nose. And after I do that, so I'm going to go ahead and check for patency, and I'm going to ask the patient to press down on the left nostril and blow out of it, press down on the right nostril and blow out. And can you tell me which nostril was more easy to blow out of?
The left.
The left nostril. Okay, so in that case, I'm going to go ahead and insert the tube in the left nostril. Okay?
Okay.
So before I get started, I'm going to insert my syringe in the tube. I'm going to aspirate about 30 mils, and this is to help in case when I insert the tube in the nose, if there's any gastric juices, it'll just flow into the tube opposed to soiling the bed, okay? I'm going to go ahead and place towel there, give the patient Emerson base. I also give the patient a cup of water with a straw so he can drink as I cue him to swallow. Okay, so I'm about to get started, Mr. Doe. Do you have any questions or concerns?
Nope, nothing.
Okay, so I've dipped my tube in some water. Mr. Doe, I'm going to go ahead and start inserting this into your nose, okay? Any discomfort while I'm doing this, and you want to take a pause, we can do that. I'll pause and stop. Wave your hand and let me know when it's too much. Okay. Then I'll pause, give you
Okay.
a few seconds, and then I'll ask you if you're ready, so we can go ahead and continue. All right.
Okay, that'll work.
Okay. To do that, I'm going to need you to tilt your head from your chest, from your chin to your chest, and then I'm going to instruct you to swallow. And as you swallow, I'm going to persist the tube down as I tell you to swallow. Okay?
Okay.
All right. At the count of 3, 1, 2, 3. Go ahead and tilt your head to your chin. Swallow. 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 Good job. Now, say for example that the patient started coughing persistently or gagging. I'll then ask the patient to relax, take a deep breath, and then I'll take my pen light and look into the patient's mouth to see if the cord is possibly kinked or coiled. If so, I will pull the tube out a little bit until it's taut, and then I'll go ahead and continue to reinsert. Okay? All right, I'm going to continue on persisting and swallow. And as you swallow, I'll go ahead and advance the tube. Okay? Swallow, swallow, swallow. Good job. We almost there. Swallow, swallow. So now we're there. We don't want to let go of the tube because we don't want it to fall out. So I'm going to go ahead and anchor. Now when anchoring the tube, I want to make sure that I am centering the tube, because if I press the tube up against the nose, it'll cause pressure, and then a pressure ulcer will proceed, and we don't want that. And so I'm going to go ahead and anchor. Sorry, Mr. Doe. Okay, so we're in. So now I'm going to go ahead and assess for breath sounds. I'm going to auscultate posterior and anterior sounds to make sure that my patient is not in respiratory distress. So that's what I'll do. And then after that, I'm going to check for placement. So in order to do that, I need to go ahead and pull out some gastric juices, probably about just 5 mils of it. And then when I check that, I will be doing a gastric pH test. If the test is 5.5 and under, I know that I'm in the stomach. But say, for example, that the gastric juices was a 5.5 and over, that will indicate that the tube is in the lung. Put a note on the tube saying do not use, and I'll go ahead and send them the x-rays so they can check placement. But in this case, the gastric juices would be under 5.5, and I will still go ahead and order to have x-rays done to make sure that the placement is in the correct place. Okay. And so I'll then take this out. I'll go ahead and add the suction on. And so I'll go ahead and apply the suction. I will place the suction, turn the suction on, and place it on intermittent, and I'll set it between 40 and 60. I will then go ahead and clip, according to facilities policy, it will tell me how to place the tube on the patient's gown so that there won't be any tugging and the tube won't come out of the nostrils. Okay. So then I'll go ahead and put the patient bed down. Miss Joe, are you doing okay?
Yep, doing great.
All right, good. You want to lay back a little bit?
Yeah, no, it's fine. I'll watch some TV.
Okay. So I'll go ahead and clean my area. Go ahead and hand hygiene. And Mr. Doe, I'll be back in about 30 minutes so I can go ahead and provide you with your nutrition, okay?
Okay.
All right. Knock, knock.
Come in.
Hi, good morning.
Morning.
Hello. Let me go ahead and hand hygiene. My name is Nairi, and I'll be your nurse for the day. Okay.
Okay.
Can you tell me your full name and date of birth, please?
John Doe 1101.
And do you have any allergies?
No, no
No
allergies.
Okay, Mr. Doe. Well, I've looked over your chart, and you have an order for nutrition. So I'm here to give you your nutrition today. Okay. Let me
Good.
get some gloves.
All right.
And so I'm going to go ahead and assess for, I'm going to assess and check your placement. And according to your chart, it said that your placement is at 61. And
Okay, so I'm gonna check the expiration date.
this is what, 65, so yeah, it's at 61. I'm going to also assess for skin integrity, just to make sure that there's no pressure ulcers up against the nose. That's fine. Your stomach, to see if there's any distension of the tummy, and also check for bowel sounds before I proceed to give you your nutrition. Okay.
Okay.
So the stomach doesn't look distended. And I'm gonna check for bowel sounds. Of course, this is in the way, but I would check all 4 conjuncts. You know, well, I guess if the person had a colostomy bag, I'll only be able to check the 2 on the right side for any hyperactive bowel sounds. And in this case, I did listen to it, and that lets me know that the nutrition that the patient had prior is working and moving down the intestines, which lets me know at some point the patient will have a bowel movement. Now, if the patient did not have any gastric bowel sounds, I would hold the nutrition and let the physician know, because that tells me it's a possibility that the patient's not tolerating the nutrition. Okay, so we heard the bowel sounds. Now I'm going to assess the gastric content from the patient's stomach. I'm going to go ahead and put a towel on the patient's chest. With my basin and syringe ready, I'm going to disconnect the suction. So I'm going to add the syringe to the NG tube, and I'm going to aspirate all of the residual content, gastric content from the patient's stomach. And so I'll do this and pull the content out up until the syringe begins to resist and pull back the plunger, and that lets me know that I've gotten all of the residual out. Now, if the residual is more than 200 mils, that tells me that possibly the patient is not tolerating the nutrition, or maybe there's something going on with the intestines and maybe it's not able to digest the nutrition. So in that case, I would hold it and I'll contact the doctor. But if the patient's content is less than 200 mils, in this case, I have 30 mils, put those 30 mils back into the patient's stomach. Then the nutrition would be safe to give. And so we're gonna get the food, we're gonna check the expiration, and then we're gonna shake it, right? And we wanna make sure that the food is at room temperature, not cold. I'm gonna go ahead and place the towel over the patient in case the patient may regurgitate. We're gonna place the basin. And so you're gonna go ahead, put the syringe in here. We're gonna kink the tube. We're gonna go ahead and flush and add 30 mils of water. Release it and make sure that the water's going in. That lets us know that the tube is not clogged. We're gonna go ahead and then pour. The order is called for the whole tube to be given. So I'll go ahead and pour into the top, release, and then right when it gets down to about 10 mils, I'll kink it again and pour the rest. And we want to do that because we want to prevent getting air into the patient's stomach, right? And so I'll repeat that process, kink it, go ahead and put the tube back. I'll then go ahead and pour 30 mils of water back in, allow the water to go in, kink it before it goes all the way down, and that lets me know that the tube is not clogged. I'm gonna go ahead and give medication, and so I'll have my medication set to the side, already crushed thin in a powder-like state. I'll go ahead and add about 15 mils of water in the cup, and then I'll go ahead and pour that in, release. Then I'll just crimp it again once they get kind of long. Go ahead and add a little bit more water to make sure I get all the medication contents down in there. Right? Then once all of that goes in there, I'll crimp it. Okay? Take this out. Go ahead and put it back in. So now in the case of if there was a clog, what I would do is I would connect it to the suction, and then I'll set it to 80 quickly. Go ahead and get that clog out the way. Or in an event where if it was clogged due to medication, I'll go ahead and add a little bit more water into it, get my plunger and just add a little bit of pressure, press it down so that the medicine can go in. Okay. Stop. Okay, so I'm going to go ahead and attach the NG tube to the patient according to the facility's policies. Let me know how to attach it here, and we're going to do that to prevent any tugging of the cord so that it will remain in. Go ahead and clean up my station.
Okay, I'm sorry. I know I'm talking right now. Check the
Go ahead and put the bed down. Go ahead and make sure the patient has the call light. And take off my gloves. Hand hygiene. All right, Mr. Doe. So I'll be back to come check on you in another 30 minutes. Do you need anything?
Nope, I'm good. I'm just gonna watch some TV.
All right. Do you want your head down, or are you comfortable?
Nope, I'm good.
Okay. All right.
I'm good. Thank
I'll see you later.
All right.
Knock knock.
Come in.
Hi. Good morning.
Morning.
Providing privacy. Do some hand hygiene. I'm Marie. I'll be your nurse today.
Good. I'm ready to go home. When can I go home?
Hopefully today. I'm gonna look at your chart and see if today's the day for discharge.
Hey.
Okay. So, can you please tell me your full name and date of birth, please?
John Doe 1101.
Any allergies?
No allergies.
All right, Mr. Doe. So I was looking over the doctor's orders, and I see that I'm here to take out your NG tube. Okay.
Good.
It's gonna be an easy 1, 2, 3, no pain. Okay.
Yay, good.
I'm gonna go ahead and place this over, just in case. Go ahead and lift up the bed.
I was gonna start with me raising the bed. Right. And that's okay. I want to make sure we don't
Go
miss
ahead and
anything.
sit you up. That's as far as you go. I think that's as far as you go.
Alright, let me grab one more extra piece of tape.
Yeah, as far as. So I'm gonna go ahead and take out the NG tube. I'm gonna start by taking off the tape. Okay. I'm sure you're gonna feel a little discomfort when I take it out, but it's gonna be quick. It's not gonna be a long process. Okay. Now at the count of 3, I'm gonna pull it out. I want you to take a deep breath. Okay. And at the count of 3, I'm gonna pull. Okay. 1, 2, 3. All right, release. Good. It is over.
Do you have any allergies? No. So I need to verify the placement again, the most accurate way.
All right, I'm gonna go ahead and put your bed down. Are you okay?
Yep, I'm good.
You want to lay back?
No, I'll watch some more TV.
Because I don't want to risk
All right, so here's your call light. All right. Go ahead and take off your gloves and just have your hygiene. So, Mr. Doe, if you need anything, make sure you push that call light, and then I'll be back to check on you in about 30 minutes, okay?
Okay.
All right.
All right. Thank you.
You're welcome. Bye.
Bye.